Have you heard about school-based health centers? Curious to know your thoughts. School-based health centers, they're not necessarily new. They're funded through the Health and Human Services Department of the federal government. Um, and with anything, I think that there's a large amount of well intent, good intent surrounding things like this. And of course, you can always say that, James, look at those that are disenfranchised, have less access to healthcare, things like that, so forth and so on. Totally get it. There's a lot of need out there. So there's no dispute there. I don't think that that's where my concern comes from. My concern is that with any well-intentioned government program that comes with this kind of funding, who is in control of it, and how can that be then abused or manipulated to where um, the good or the well-intention behind its origination is chipped away, diminished, to where now you have this imbalance of the good that it could do, um, outweighed by the bad that it does. All right. And so that's where my position is. So I'm still in the middle of a concern. And a lot of that derives from parental consent and parental notice. Because in our current public school environment, if you haven't noticed, there's sort of these opposing forces. It depends on the school system. In a lot of places, it still is functioning. But there are a lot of locations and a growing number of locations to where the parents of children seem to be diametrically opposed to what the Board of Education's and what the teachers union and what the teachers are doing, to where you have this political collision to where now something that seems benign and beneficial, like health-based, school-based health centers, now become a political object of disagreement because there's one group that, if they have control over the school-based health centers, can then start to chip away at what I believe is a very real um, requirement, and that is parental consent. I am still one of these individuals that do not believe that children are emotionally equipped, mentally equipped, intellectually equipped to make the majority of their own decisions. I know what I thought when I was a old 17-year-old, and at that point, I look back now retrospectively, and I'm glad that I did not, that I had my parents and the wisdom and the counsel and the direction that they were able to provide. And I understand that that's not the case for many individuals, but this is where, guys, we need to understand our place and our roles and not desire to intercede in everybody else's business that isn't our own. Now, I understand that there needs to be that balance. That's why we have things like mandatory reporting and things of that nature. At the same time, I believe that those are rare situations comparatively. And, at those points, we also have mechanisms within our law to address that. And that is our court systems, including probate court. There's even mechanisms for children to separate themselves from parental decision making. It happens. But at the same time, I do not believe that it is within the power, nor the priority, nor the business of the teachers union of teachers and administrators to circumvent parental rights and utilize school-based healthcare centers for what I consider um, not honest purposes and politically motivated purposes under the guise of healthcare. So no, if it excludes parental right, if it excludes parental involvement, no, I do not agree with it. And that also includes, guys, the over sexualization of our children. And I know some of you are going to say, guys, they're doing it. Yeah, I was that age once. Okay, I completely understand that, and I'm not saying that there shouldn't be access to um, those items. But once again, what I am troubled by is the collision or the opposition between parental rights and these desires to circumvent that, to have children making lifelong decisions that have lifelong consequences prior to their ability to do so. And that is recognized in most of our states as either 18 or 19, that we feel like you are equipped now to go into the world and make decisions autonomously. And if you don't, we have probate courts to sit there and weigh that and make those determinations on whether or not the child requires guardianship, for example. So I don't believe by pushing and removing these what I just consider obstacles. Okay, they're not stops because, like I said, there's legal mechanisms for children to act autonomously if they can justifiably prove that need. Okay, but outside of that, no, I really do believe, due to science, that children are maladaptive. Their brains are developing at a high rate. They're emotionally dysregulated. Not maladaptive. I should have said dysregulated. Sorry. That children are dysregulated naturally, all of them. That doesn't include kids that have a disability or a diagnosis. It just means all children are dysregulated. So at that point, we need to respect that. We need to respect that process. We need to protect our children. We need to protect our children from predators that exist out there that have figured out that our public school systems are now free reign. We're not doing enough to protect them there. And a lot of that has to do with the fact that a lot of these predators have figured out that it's very hard to get rid of them. And especially because the political winds have changed to where we have a very loud minority position that believes that it has the power and control to assert itself um, over parents. And I do not agree with that. Don't agree with it. It's a dangerous, dangerous road to go down. It's dangerous for multiple reasons, but from a civil rights perspective, it's dangerous when the minority position uh, takes it too far. Because I've tried to explain this to people. You know, civil rights is a balance. It's a balance of reasonableness. And if it gets out of that balance, guys, you have a majority over here that, quite frankly, anytime it wants to sit there and get itself worked up into a mob mentality, it's the minority position that suffers. And so there needs to maintain a balance of reasonableness. And that reasonableness is what keeps the mob, that majority position, from coming over and smashing the minority position. Okay? It's a balance of reasonableness. And sometimes minority positions, due to political radicalism, can go to extremes. And when that happens, it hurts everybody. All right? We need to remain in that balance of reasonableness. That's where we need to remain.